right, lovely people. So I have with me here these wonderful critical care nurses, and they are celebrating their 10 years anniversary. That is, a wonderful milestone that we need to join in that celebration. And we want to have a word or two with them. My sister, so one might ask, what does it take to be a critical care nurse?
In Ghana, if you have to be a critical care nurse, first of all, you should have done your basic nursing.
Okay.
Either at the nurses training college or at the university. Okay. So you need basically the degree or a diploma in nursing. Then you should have at least 1 year experience in the field. That is, if your institution wants to sponsor you, or 3 years experience. This experience is very important because critical care nursing is quite advanced, and without experience you really struggle with knowledge and with the skill. So you really need this experience to be able to be a critical care nurse or go to the critical care nursing school.
And to add to my sister's comment, the training is done at the very operative and critical care nursing school in Kolebu, which is situated in Kolebu.
Okay.
And post-diploma or post-degree, as she rightly said, you have to do 2 years. Okay. And you'll be awarded BSc in critical care nursing, and you can practice with confidence. And quite recently, the Ghana College of Nurses and Midwives also introduced the course as a specialty. Okay. And so for that, you would need the minimum requirement of a degree and then 3 years experience, as she has said, and you can apply to the Ghana College of Nursing, and you graduate as a member in the Faculty of Critical Care Nursing.
Just to add something to what they are saying, we also have associate member in critical care nursing. So after completing your 2 years BSc in critical care nursing, you have the chance of doing 1 or 2 months training in critical care nursing. Then you'll be awarded an associate member or associate degree in critical care nursing. But in the nutshell, you can use that one to further your education in the membership program. That's membership in what? Critical care nursing.
Wonderful. Guys, can you share with us some of the rewarding moments in your career? I know, your work schedule is quite tougher, the environment, a lot of pressure. But in spite of all these challenging environments, can you share with the public some rewarding moments that you can?
I think for us, the rewarding moment will be when we see our patients discharged or move to the ward in a stable condition. Like most people have said in the conference, as a critical care nurse, we were expecting that we'll get some special reward. You know what I mean?
Yeah.
Yes, so that we can also be motivated to work. But that has not been in place yet, which is a deterrent to most people. But trust me, the reward you get from the patient, the satisfaction you get, is also something you can compensate yourself with. And especially when you have nursed a patient for more than a year. Imagine a patient in the ICU for more than a year who eventually leaves and comes to visit you.
Wow.
You take the pictures with smile, you know, yes, I have done something.
What's more beautiful than seeing a patient who is almost dying just sit up and begin to smile? Yes. That's joy you have as a human being. To see a relative smile is enough reward. Yes.
The joy of seeing a patient who has recovered fully from anesthesia, from a long illness, who has a tracheostomy tube in place for months. In the end, the patient is discharged home. Patient and relatives comes back to the facility to say thank you for the tremendous care you've given to him already. That one alone is rewarding to us as critical care nurses. And our main aim is not centered on only the patient, but we include the patient and what?
The family.
And the family as well in the care of the patient. And we give optimum care to our patients or patients under our care. And that is to add more to this. Critical care nurses not only work in the ICU or ATU, we work at where critical patients are. Because it's not all the hospitals that have critical care units or ICUs in them or ATUs. So wherever you find yourself as a critical care nurse, wherever you have a critical care patient on admission, that patient is under your care. And that's why we are giving specialized training and providing this care to our patients and their relatives as well.
And that is not to say that The fact that we get the satisfaction from our patient, we don't need the other compensation as well.
You can let our
Yes.
viewers know. I mean,
yeah, because at the end of the day,
Yeah.
the economy we did too, and we have to face it and face the challenges despite our work pressures. So we need something to cushion us.
so
Thank you.
can. I mean, what things exactly in terms of equipment? Because I mean, at the peak of the pandemic, a lot of people were scared, especially with ventilators. So,
Yes.
if you can talk to us something about it.
Let's look at it in different dimensions. The human resource aspect, the financial aspect.
Exactly.
We should be well resourced to provide care to our patients. And as specialized nurses, we work with sophisticated gadgets, the ventilators, the perfusers, the cardiac monitors, the volumetric pump that you made mention of, even the defibrillators. You go to a facility, they have none of these machines that I've mentioned of, especially with those coming from up north. It's not easy managing cases without all these gadgets. And for the human resource, for the financial aspect, there's exodus of nurses. Our colleagues are what?
Migrating to other places.
So the question we ask ourselves is, we those who have decided to stay back and help our mother garden, what can the government do
To keep us.
to keep us, to prevent us from living? And it's all boils down to what? Proper regulation. We are not asking for so much. And try and ruminate us well, so that it will prevent us from what? Living. So the care we give to our patients outside, at least when you go back home, at least you can smile, you'll be able to take care of certain things that someone outside the hood does.
Thank you
you.
so much, guys. I mean, it's been a wonderful moment, and at a point in time, we try to get emotional because I mean,
Yeah, of course.
these are. I mean, so you understand what I mean by the nurses with the third eye. These guys are doing amazing, in fact, very amazing stuff. And we thank you guys.
In fact,
Thank you.
just to add before we conclude, when we went for the regional visitations,
Okay.
you could see people doing a lot of improvisation just to rescue life. All this, like I said, to what? So I keep on stressing, we get satisfaction from our patient, but we need our pockets to be satisfied too. Thank you very much.